What now?
Truth or dare?
Oh, no, you don't want to mess with me. Truth or dare queen in Newton North.
I was kidding. I'm sure we can find something interesting to talk about without relying on some juvenile game.
Sure.
Truth.
Truth.
All right. Have you ever had a threesome?
No.
You haven't?
But just because I'm bisexual.
Well, yeah.
Do you understand what bisexual means? It doesn't mean you have sex with two people at once. And by the way, you didn't ask me if I'd had a foursome. Truth or dare?
Wait, you've had a foursome?
No, but now you've asked me two questions, so I get to ask you two. You see why I was the queen.
Oh.
Truth.
How did your dad react when you came out to him?
He made me tea. Seriously, doesn't matter what I tell him. He smiles, tells me he supports me, and makes me some peppermint tea. Truth or dare?
Truth.
Are you dating anyone?
Now? No.
Interesting. You added a modifier. Truth.
When you were dating Foreman...
No.
What?
If it was something personal about him or us, I just don't think that's right to answer. We all work together.
That's the whole point of this game. Something personal, preferably embarrassing.
Just pick something else.
You see, this is your problem. You act like you're so liberal and open, but you are the
I
least...
changed my mind. Dare. Just no nudity.
Yes, nudity. I want you to show your breasts to Taub.
That is the most idiotic dare ever. Have you ever played this game?
Well, I thought showing me your breasts would be a little exploitative.
Dare is in the future, genius.
Hey, if you're saying you won't do it...
No. Of course I'll show my breasts to Taub. Tomorrow, perhaps, or maybe sometime next year. You know, because I'm honor-bound. Truth or dare?
Truth.
You said you weren't dating anyone now. Does that mean you recently were or soon will be? Oh, look who's guarded now. You had no problem talking about your sex life, but your love life. Fine, dare it is.
No nudity, now or in the future.
You're too much of a nice boy, Wilson. Let's let the bad boy out for a bit. You have to go steal $1 right now.
From who? Oh, come on. Hey, Daria.
Dr. Wilson?
Could you cook me up a chicken sandwich?
Girl's closed.
It's important medically. Dr. Hadley needs a high-protein meal right now. She doesn't like to talk about it, but she has hypoproteinemia.
We get chicken salad.
Yeah, that's cold.
She needs to eat warm protein for this disease.
Well, we could give her cold protein, whose uptake enzymes haven't been activated, as long as you don't mind her risking liver and kidney failure and eventual death. But hey, it's worth it, so you don't have to flip on the grill.
You don't have to be obnoxious about it.
Truth.
Shut up.
I'm sorry.
It's not your fault.
No, I didn't even play fair. You asked me how my dad reacted when I told him I was bisexual, and the Huntingtons.
No tea party?
I never told him. He's been through enough.
So he just visits his heterosexual, healthy daughter, and you go out to dinner and a movie and talk about your garden?
I work late. He's staying at my house. It's easier if I stay elsewhere as much as I can.
You can't suppress your life for his convenience.
You don't see a little irony in that? That's exactly what you do for House. I mean, he moved in with you. You bought a bigger place for him. No wonder you're not dating anyone.
You're right. That woman, the woman I'm not involved with, her name is Sam Carr, but in 1990 and 1991, it was Sam Wilson.
Your ex-wife?
No, my mother. Yes, my ex-wife. Ex-number 1. She friended me a few weeks ago. We started emailing. It turns out she's recently divorced, and I wanted to ask her out.
You can't take a woman to dinner or else House will go running straight back to the loony bin? You're not worried about House, you're worried about yourself because she's an ex. So even dinner will mean it's immediately serious.
I just asked Sam to dinner.
Little baby's all grown up.
You gonna tell your dad?
Yeah, I'll stop by his hotel, talk to him.
Hotel? You said he was staying at your apartment. Was there any truth in anything you said?
The part about it being a good idea for you to call Sam. That was true.
Good night, Remy.
Good night, James.
Code 7 has been lifted.
You must be Dr. 13.
Remy, Hadley. Nice to meet you.
You back?
Hi.
What the hell happened to you? Why'd you lie about going to Rome?
You'd lie too if you bottomed out. Ended up in drug rehab.
Thank you, House, for respecting my privacy.
What a perfect reminder that I'm back.
I didn't even know you had a problem.
Loved ones are always the last to know. Loved ones and robotic estranged ex-boyfriends. Our patient is Kendall Pearson, 16-year-old aspiring pirate.
She's a Canadian kid who's trying to be the youngest person to sail around the world.
She collapsed yesterday during a practice run. Luckily for us, cameras were there. Corporate sponsors want us to check that she's seaworthy before the clock strikes. You're too old to set a record. Gives us 3 days. You've still only got 1, right?
Last day as a student. Could be simple dehydration. She told the Coast Guard she had felt dizzy.
Pulse and BP were normal at the time of the rescue. It's not dehydration. What about your internship? You sign up this morning?
Actually, I'm still deciding. Maybe she had a seizure, and that's what caused her collapse.
Coast Guard report says no sign of head trauma.
What about her back? Look, right before the collapse, she hit the small of her back on the railing. Damaged adrenal glands caused adrenal insufficiencies, which caused the collapse.
Nice. Blood draws every 15 minutes for 4 hours. Let's track her cortisol. Masters, there's no hurry. There's no wrong choices. At least that's what they tell people who make crappy choices.
What's with the sudden interest in her future?
You know, a blacksmith who spends this much time hammering out a new blade from raw jello. Gets curious about who ends up wielding it.
No reason to be curious unless you're interested in wielding it yourself. You want her to intern here.
And you're considering this?
Before I make my decision, I still have one more LP I need to get, so I'd like to go to the ER.
13, why don't you take Masters to do the blood draws? You can remind her about all the perks of working for me.
Behind the deck, port side.
If her adrenal hormone levels are consistently low, we'll replace them. You'll be ready to launch Thursday.
Great. Inside cabin facing the bow.
Sorry, Kay. Need to borrow Mom.
The sponsors?
No, Kirk's people kicking up a fuss about rescheduling the interview.
I can take over. Ceiling of the galley. Right. The last time I was on a boat was my freshman mixer in college. I didn't so much mix as hurl.
Too much to drink?
No, I was 13.
And in college?
Yeah, I know. Weird.
I was thinking, cool.
We'll be back for the next blood draw in 15 minutes. Unless, of course, you'd like to stay and continue bonding over your lost childhoods.
Listen, I have a ton of prep work to do to be ready to launch. Is there any way we can speed the tests up?
I'm afraid not.
Unless you're up for getting on a treadmill. We could stress her body, see if her adrenals respond. It would only take half an hour. It's about an LP.
Go. I'll handle this. Rehab. Great cover story. Now I can't ever drink around those guys again, thus eliminating my main bond with Chase.
Save the attitude for someone who didn't just get you your medical license back. Price you pay.
There's a chicken in your office.
No, there isn't.
You lied about rehab?
Oh, great.
Relax. She's completely honest, but also completely boring. What's this? Don't tell anyone.
Of course not. You did an LP? Why didn't you page me?
Oh, I'm sorry. Did you want to do one of those? You should have spoken up. You want the job or not?
After careful consideration, I have decided to accept your offer for an internship.
Great. My department has a slightly different procedure log.
You forged the last one. I only did 9 LPs.
Do you know how to do an LP?
Of course.
Do you know how to do 9 LPs and say it was 10? It's time to grow up. Turn that in, the job's yours. Stop staring blankly and go. No doubt something horrible has just happened to our patient.
Can someone please explain to me what House and Wilson are doing with those chickens?
They have a bet to see who can keep a chicken in the hospital the longest without getting busted by security. Advancing past the vertebral artery.
And why are they doing this?
The place they bought them only had 1 pig. I'm glad you're gonna be sticking around after today.
Really? You want me to stay?
It's good to add a different perspective to the department. Someone who still remembers there are rules other than houses.
If I don't play by House's rules, he won't let me in.
Find a way around them.
I'd have to lie to him, which is still lying.
Lying about a lie, that's practically telling the truth. Catheters in, start the calcium channel blocker drip.
Means I need another LP.
Luckily, I know where you can get one. You good here? Let's go. Decent stick, very smooth.
Sounds like you've had a few of these. I suppose that comes with the territory.
I have Huntington's. No need to get hushed and solemn about it.
Why are you lying about rehab?
Because the real reason I was gone is not something I want to share.
Couldn't you just say that? Should be enough for Foreman and the others.
How long have you worked here? House's people have personalities that range from nosy to pardon me while I do this cavity search.
Do you think there's room for someone who does things differently?
No. Not unless House decides that's what he wants.
During catheter removal, I got a good look at her cerebral midline. Pineal gland is calcified.
Case closed. We'll start her on hormone therapy. Ship her out.
I handed in my log.
On your way to do that, you happen to stop and give 13 an LP. 13 stiff gait, small pupils, and the raging headache she's hiding gave you away.
Yes. And I still broke a rule.
My rule. Told you to defy the man, not this man.
Why is it so wrong that I don't like to cheat?
Can we go?
No. Not liking it is fine. Not doing what you don't like makes you an 8-year-old. Wastes your potential.
You want me to be like you, it's not gonna happen.
That's the last thing I want, because then neither one of us would be exceptional.
You think I'm exceptional?
Not anymore.
I can do my job without compromising.
No, you can't. I'm not gonna let you. Internship's gone. It's time for Masters to say goodbye. Enjoy being a surgeon. You'll be fine.
You can see the full lobular structure of the left lung.
Bifurcate and nominate artery. I've never seen one of those before.
Hold this, Masters.
Rib spreaders.
You guys okay if I pull a circulating nurse? We got a train wreck in OR 10.
You got it.
Proximal end attached.
Can someone take the retractors for me?
Not really.
I have to use the bathroom.
I know you're a rookie, but you gotta be kidding.
I'm not.
It can wait.
I'm gonna have an accident.
Next one in line, grab it.
What's wrong?
Hypotension, low cardiac output. Float the swan.
Don't you have your own surgery?
I took a break. I told them I had to pee.
Lie. A small one, but it's a gateway lie.
I care about the patient.
Another lie. You care about being exceptional.
I told her dad I was gonna take care of her.
A third lie. Welcome to the slippery slope.
RA is 8, equalization of pressures.
And she has restrictive pericarditis.
Add that to a calcified pineal gland.
When is a calcified pineal gland not a calcified pineal gland? I realize technically it's never, but
When it's a granuloma, it's Wegner's. We should start her on steroids.
But she had a high CK. Wigner's wouldn't explain that.
Dehydration does.
Yes, but the calcified pineal could be sarcoidosis.
you had me at I had to pee. 13's right. Start her on threefold immunosuppressants. Masters, if you want to fight me on this, fill out a consult form so you can stick around. Welcome back.
I'm not back. I'll just be staying for this case.
You got really good at this lying thing.
You killed your own brother.
Yes, it was awful and devastating, but it wasn't murder. He was sick and he wanted to die, and I promised I would help. Now please stop pacing and help me find this thing.
You talk to anybody about it? I mean, are you okay?
No, I may have an aortic arch aneurysm. Oh, wait, that's her. Either help me or leave. I'm having trouble getting a clear look.
Try long axis view from the suprasternal notch.
Wait, put on some gloves. She's got hep C.
Wonderful. Take it you two are cellmates.
Just friends.
She saved me. There's a culture in prison. If you don't have someone to show you how to get the stuff you need, stay away from the stuff you don't, you're screwed.
Your fingers are turning blue. Can you move those?
My arm's starting to go numb.
Arch of the aorta is clear. This can't be an aneurysm.
Maybe the wound through a clot. Check axillary arteries. Stop. Right there.
5-centimeter gooey mass. Not a clot, maybe a lipoma?
What the hell is that?
Fat-filled sac, probably aggravated by the stab wound. You got any syringes in here?
Give me that.
I was stabbed in my gut, not in my arm.
You lost a lot of blood, gave the lipoma room to swell. It's compressing the arteries in your arm, blocking your blood flow. Maybe we can suck some of it out. You'll be fine. A little pinch.
That's not a lipoma.
Try moving your fingers again. Good. Means it's almost drained.
Not good enough. We don't know if it's going to come back. We don't even know what it is. Drugs, viruses, toxins from that crack house, and God knows where else she's been.
If this were caused by the drugs, she'd have kidney failure, cardiac involvement.
What about her hep C? Her phyto liver loses its synthetic function.
Then her entire body would be swelling, not just her arm.
Loses with toxins. Where exactly were you when you were attacked?
You're not doing a home search in a crack den. That's insane.
Apparently, we don't have much of a choice.
It's a crime scene. And it's not toxins or viruses or anything else you mentioned because it's not a coincidence. Her symptoms have to be related to the stabbing. What if her body used up all the clotting factors dealing with the stab wound?
Explains the bloody mass. But if you're right, she could start bleeding anywhere, like in her brain or in her heart.
One of those things could start growing in my brain.
It's time to get you to the hospital.
Remy, you promised.
All we'll do at the hospital is stick her in a patient bed and give her IV clotting factor. We could do that right here.
We could also embalm her right here.
I'll call the drugs and you go pick them up. If I'm right, she'll be fine. Look, I know you don't know her and you don't care about her, but I do. Please. Lie down. Elevate your shoulder. You said Andre wasn't responsible for the drugs. What is?
I don't know.
Yes, you do. What happened to you? If you don't deal with the real problem, you're just...
because you were a doctor, not a shrink. No, please don't. Please, please put the gun down.
Put it down on the ground and get away.
Dee.
I'm sorry. I'm sorry. I'm sorry.
Dee, what is it?
I'm so sorry. I'm sorry.
She hallucinated. I need you to go back out. I just called in more clotting factor.
So she's bleeding in her brain now?
We double up the dose, she'll be fine.
No. We bring her to the hospital, we do a CT scan to locate the bleed, drill a burr hole in her skull, and maybe she'll be fine.
We can drill a burr hole here.
You're not just risking our careers here. You could go back to prison.
I made a promise.
You made a promise?
I will not take her to the hospital.
Great. Then I will.
No.
I'm gonna move you. And I'm gonna pick your friend up, carry her down to my car, take her to the hospital, and try to save her life.
She's staying here.
Move. Move! She's going to the hospital.
Elevator, head more.
Don't bother. Cops are gonna be waiting at the front door.
I'll go in first. Find a patient on life support just waiting to die. We'll use that name in all your tests. No one will ever know you there.
Thanks. Stop screaming, my head hurts.
I need you to stay awake. Talk to me.
About what?
When you were screaming in my room, what did you think you saw? You said, put it down on the ground and get away.
Sounds like a cop.
Old habits, I guess.
You were a cop?
Back when I was a decent person.
How do I not know this? You knew everything.
Not a good resume when you're trying to survive in prison.
So who are you talking to in my bedroom? Why did you keep apologizing?
Because I'm sorry.
For what?
I killed a kid. He was 19. I went in first. Saw him going for his gun. I tried to talk him down, but... they told me I was a hero.
So that's when you started using drugs. I'm sorry. Darian. Darian! She lost consciousness. Shockingly, a punk kid getting shot pulling a gun on a cop did not make national news.
Is your neck okay?
Yeah, it's fine.
I'll get you some ice.
I said it was fine.
I shouldn't have grabbed you so hard.
You had to. You were right. About everything. I got something. Darian must have had a different last name then. She must have been married.
2008, is it possible?
We never actually talked about how long she'd been in.
House was right. She could have only had a Hep C for a few years.
There's no way the prison would have prescribed interferon unless the lab showed her Hep C to be chronic.
So what makes new Hep C look like old Hep C?
What if she got a parasite? The Hep C made her susceptible, and the parasite sped up the liver damage.
Entamoeba. If they were in a parasitoma, the stab wound could have freed them, sent them coursing through her bloodstream, wreaking havoc.
A single bag of metronidazole. If we're right, she could wake up from the coma in a few hours. Can you hear me?
Yeah.
You had parasites in your liver. Probably from a dirty needle, or prison, or who knows what. The stabbing made it worse, but you're gonna be okay.
We've only got one symptom to go on, sudden onset paralysis.
We actually have 2 symptoms. Only one that we remember.
You did a full workup on the guy. Did you find anything?
CT ruled out subdural hematoma, stroke, or subarachnoid hemorrhage.
Guillain-Barré fits.
Just trying to figure out what Guillain-Barré looks like.
You can't just eliminate everything because it doesn't match what you might have seen.
How about because it doesn't match what I could have seen? Guillain-Barré has no external physical manifestations.
Everything has some external physical manifestations, and you're obsessive enough to notice any of them, which means there's nothing we can rule out.
Elevated white count means transverse myelitis is...
Sudden paralysis while driving a bus. That's a sort of subtle clue that only a genius would have noticed.
Are you sure you're feeling okay?
Where are you going?
Smell a bus, obviously.
Yeah, I'll start him on antibiotics in case it's transverse myelitis. You guys go sniff a city bus.
Why are you smelling the passenger's clothes?
Smell is the most powerful evocerator of memory. I need to get back on that bus.
Okay, so why are you taking so much Vicodin?
Cuddy asks. Blocking the pain helps focus the memory.
You split your head open. You should rest. Anything?
Hint of exploded bus.
House. That's 4 Vicodin in 40 seconds. At this rate...
Wish me luck. I'm going in, Rambo style.
House, do you think this is gonna work, or are you just stoned?
My legs are holding.
Good. Now put all your weight on your right leg. The antibiotics are working. It's TM.
It's 2 in the morning. You should be home resting what's left of your bruised brain.
Recovery's too fast.
But the fact that he's getting better is evidence that we're wrong?
Oh, I need to sit.
Recovery slow enough for you now?
Oh, it's my stomach. Ah.
Which means it's not transverse myelitis.
Rapid onset could be a perforated ulcer.
Wouldn't explain the paralysis. Addison's, from a tumor. It's possible that I saw his eyelids droop.
We've scanned his head 5 times. You're bleeding.
Little thing called a bus crash. It's just a scalp laceration. Could be hidden in his optic chiasm.
It's coming from your ear. I think that's a good thing.
And that would have affected his eyesight. I need to take a bath.
Hallucinations and smells were kind of working, right? Why the bath?
Hypnosis gave me a nose picker. Smell set off hallucinations. Sensory deprivation should get the brain into an alpha-theta phase. Did you see Altered States?
I don't think I was even born when that movie was out.
Well, you're too young to be a doctor. That movie was released in 1980.
That was 28 years ago.
No, it wasn't. Shut up.
Did you just forget what year it is?
No, I just remembered how old I am. I need to give my brain time to transition so I can embrace my inner monkey. Or maybe I don't. Give me some physostigmine. Crosses the blood-brain barrier.
Man, act like a nerve gas. Stop your heart. You'll go to heaven and be omniscient. Good idea. Not gonna happen.
Don't do anything. Even if I escape, eat a goat, and get shot by police.
Wasn't born yet means I won't be entertained by further reference.
How many more bagels do I have to eat for this to work?
High carbs plus exercise is the quickest way to confirm TPP.
I've been on this for half an hour. I'm not gonna collapse again.
Up to speed?
Keep eating.
Yeah?
So the carbo loading marathon isn't working. Stop looking around suspiciously.
To answer your next 2 questions, no, I am not there, and yes, you are completely predictable.
If the tester worked, he would have called to put my delicate brain at ease.
Still wiping. Put the phone up to bus driver's grill.
Who are you talking to?
My large colon.
TPP is not consistent with
Your patient's labored breathing.
Patient has labored breathing because he's been on a treadmill for the last 30 minutes.
Did you take my cell phone?
My large colon did. I'm negotiating its release.
Help!
What's happening?
The test worked. He collapsed.
You're half right.
Wheezing his name.
Yeah?
Can't wheeze without moving your chest muscles.
This isn't TPP.
Then what is it?
How am I supposed to know? I'm not there.
Right heart strain, he's still not oxygenating.
Must be a pulmonary embolism.
So I've just pushed a vial of TPA.
You let him back in?
I asked him back in.
The tail end of me patiently explaining how you idiots were idiots.
Pushed TPA 10 minutes ago.
That means it's not a clot.
Has to be a clot. If he had a bagel stuck in his windpipe, I'd have seen it on the echo.
Get him to the OR to suck it out.
You must have just screwed up the intubation. Seal's good.
It's a clot, House.
Wait. Look at his teeth. He's got shiny new caps. He's had recent dental surgery.
You can tell us what that means while we're rolling him to the OR.
House! Oh, get a syringe.
I didn't bring you back here so you could stage a coup.
Listen to me. Dental air drill pushed an air bubble into his gums. Dislodged while he's driving, caused a myoclonic jerk. That's what I must have seen. And it hit his spine, his liver, now his lungs.
Dr. Hadley, open the door.
I'm not plumping his pillows here. I'm putting him in the Trendelenburg position. Move the bubble to the apex of his heart so you can suck it out. Now get the damn syringe.
I can't risk you stabbing him in the heart looking for an unconfirmed air bubble.
Stab him.
Dr. Hadley!
See, she doesn't even know your name. Stab his heart.
Stats at 75.
Yes, he's suffocating.
If you're wrong.
Shut up and make a decision. Keep standing there, he's dead either way.
Dr. Hadley! I'm sorry. Open that door. Get that door open.
Don't shoot!
Get him to the OR.
CO2 sats. It was an air bubble. He's okay.
He's coming out of it.
Strong pulse.
You idiot. Your heart stopped.
Amber.
What?
Amber. It was Amber. She was on the bus.
Almost kill yourself. And all we're getting is drug-induced fantasies.
Have you spoken to her?
She's probably working. She's been on call. I called her. She didn't call. How could she?
I don't know. Jane Doe number 2.
Female, late 20s, kidney damage. Does Amber have a birthmark on her right shoulder blade?
She was on the bus with me. She's the one who's dying. Technically, you're back right now.
I need you to stop calling me. First 17 messages were cute, but
Putting the band back together.
interesting that you've never showed up at my place, what with your love of annoying me and your inability to take note for an answer. I'm guessing ankle monitor.
Guilty as charged. Literally.
I'm not a doctor anymore, House.
The job went away, but not the profession. You look healthy, so that's not it. You met a boy. Or a girl. Fall in love, want to be happy. You decided to enjoy what time you have left. You're going to Thailand.
Girl. And Mykonos. Turns out I like boring.
No, you want to like boring. But if you actually like boring, you would have figured that out in 5th grade when you were bored.
Please stop calling me.
No. You showed up to tell me that you don't want to hear from me. Huh? It's a mixed signal. I'm going to choose to listen to your actions rather than your words, 'cause they're more honest.
Why is she here?
Because I called her. Bigger question is why that worked.
I'm here because I have time and you have a crisis.
We're
and
too
I'm
busy for rationalizations. Patient made a big downgrade in his personal life. He's probably not eating all that healthy.
Magnesium deficiency?
Wait until they take him back to his room, draw blood, do an expanded electrolyte profile.
No, he hasn't had anxiety or any trouble sleeping. I think it's Whipple's disease.
Bad idea. He doesn't have joint pain.
Joint pain is common, but not definitive. Whipple's explains all of his symptoms, including the personality change, and it would respond to antibiotics, which is why he started to feel better, which doesn't mean he's not still sick.
You were right. Counts for nothing if you can't defend it. Book a procedure room, do an upper endoscopy, and run a PCR test for Whipple's. Guilt. You feel guilty about leaving.
Yes, I think that little of you and that much of me. You're nothing without me.
Not leaving me, leaving humanity.
I'm going with my girlfriend, the woman I love.
To have fun.
You're trying to make me feel guilty because you're saving lives here. And I think that's great. I'm proud to have been a part of it, but now I just want to be happy.
No one's unhappy in Greece.
Can I help you?
I'm his wife. We're separated. I heard he was sick. I just wanted to see him. He's giving a kidney to someone he's never met.
He wants to, yeah. I know he's talked about you. He's been alone all this time. I'm sure it would mean a lot to him to see you.
I wanted to spend my life with him, but I need to feel like he loves me more than other people. Like he loves our kids more. Maybe that's selfish. I should go.
Was that my wife?
You the guy, the kidney donor?
There was a problem, but I'm gonna try again.
To give it to the same lady?
She needs it.
Okay. Never mind.
Wait. What do you want?
It's nothing, it's just... I have polycystic kidney disease, and I need a transplant, and they say I don't have much time, so when I heard that you were willing, But I am glad it's going to someone.
I'll give it to you.
You already promised it to someone else.
I have another one. Saving one life is good. Saving two is better.
You give away 2 kidneys and you die.
I could live on dialysis for years.
Yes, and then you die.
And then I could donate my other organs. Heart, lungs. I could save 4 or 5 more lives.
Foreman's gonna need a diagnostician. This guy is crazy.
Arrhythmia, muscle tremors, and yes, mental changes. If his heart doesn't rupture, he's liable to rip it out and give it away.
You know, the down vibe in here is totally ruining my Charlie's Angels fantasy. That haircut isn't helping either.
Seems like Graves' disease or some other thyroid issue.
Is she on the team now? Like, forever? His thyroid levels were within normal range when he was admitted.
Could be Coxsackie B virus.
You know, pericarditis.
What about porphyria? It's a little weird without the rash, but it fits all of his other symptoms.
And if it is acute intermittent porphyria, that would explain why his symptoms keep recurring.
It's unlikely. It's possible. What else? I said, what else? Oh, for cool. There, it's better. Now, what else? Well, if there's nothing better than possible, then possible gets upgraded to probable.
I'll start him on hematin.
No, I'll go.
So what's the answer? Are you now on the team? Like, forever?
I don't know.
Because I was thinking of ordering t-shirts.
I don't know, House. I mean, what am I supposed to do? I trained to be a doctor. I know how to take someone's pain away, how to make a stopped heart beat again. We've brought people's kids back, their husbands, and...
So, guilt.
Yes, you were right. You were always right. I have the skills to help people. Is it okay for me to walk away from that because I want to just have fun?
Obviously not.
It's so hard in times like now to hold on. The guns they wait to be stopped
13.
at my side.
Need a minute.
There ain't no one going to turn me around.
You're fired.
Now what? House, I'm starving.
I'm not joking. You're fired. Don't come in tomorrow.
House.
I can work with people who've got nowhere else to go, people who've got something to prove, people who just get off on weird cases, but I can't work with someone who's here so she doesn't have to feel bad.
You're trying to save me.
Yes, I think that little of you and that much of me.
They'll zip you up and dress you down, stand you in a row. But you know you don't have to. You can just say no.
Okay.
And there ain't no one.
Bye, House.